Let's talk about the fear around chemotherapy. I think it's Friday and we like to really debunk some myths and fears around cancer treatment. And all the patients and their families are always really scared about chemotherapy. Can I tell you, chemotherapy has a long story. Over 40 years, 60 years, 80 years ago, chemo actually was discovered, treated with so many other cancers. But over the years, we've really gotten very smart and much better in controlling the side effect that comes with it. So I cannot tell sometimes if the fear is just from general misinformation on the public, space like, social media, or is it actually from lived experiences, or is it actually from the oncologist himself or herself who told you cancer is very toxic and should not be given to, or should not be part of the treatment of cancer. If it is, of course, something you pick up from the internet and TikTok, then you shouldn't even believe that to begin with. You should, listen to the oncologists and the nurses and the people who actually give the chemotherapy. So speaking about the side effect, you don't just come to the hospital and then you're hooked up on a chemo IV line. That's not how it works. We give you medication that really helps you with nausea ahead of time before you even feel that. We prevent ahead of time, and medication that helps with getting sick to your stomach. We give you drugs that actually help you not to get reacting, not to make you react to the chemo. We give you ahead of time drugs like steroids that help with the potential inflammation that can be triggered by this chemotherapy that goes through your body system. And we give you drugs that help you with nausea, vomiting, all these medication, the ones that help with the fever, because you might have a little bit of a low grade fever when you start getting the chemo. All this is taken care of, and then that is ahead of time when you are not given even the chemo. And then the IV line of the chemo is being given carefully, monitored by an oncology nurse who knows, exactly how to give and what speed and with drops per minute and everything. And then after you finish even the treatment, we discharge you with drugs that are tablet that you can take for late side effects. Most of them are tablet based for like maybe 3 to 4 days, just to make sure that late side effects don't really come in when you're away from the hospital. So I think we've really gotten better. The fear around the cancer treatment and chemotherapy is, that is most of the time is misguided. In the hands of a trained doctor or an oncologist or an oncology nurse, with the right drug for the right patient, you should be okay. And definitely your doctors and your team are aware of you, and they're on the. You can always call back for like side effects and all that. So before you reject chemo, we're going to talk about the other drugs that are better than chemo. Of course, during the years, we've gotten better in not giving chemo to everyone. And with the new research, actually, some of the cancers can be treated without chemo. So, but do not blatantly, say I do not want chemo because of just the fears you have. Give it a chance, talk to the doctor, ask them about there's potential side effect, benefits and risks, and if you are the right person to get the right dose and which drug and which not, which drug you're not supposed to get. I hope this helps. Please share this with anyone who is currently has chemophobia or who is about to get cancer treatment. And